What is the purpose of nursing assessment? A. To make nursing diagnosis. B. To collect basic data regarding health. C. To provide intervention. D. To give health education. And the correct answer is B. To collect basic data regarding health. Assessment provide basic data regarding the client which help us to find out the actual and potential problem as well as changes occurs in client's health during the treatment course. The nurse is auscultating the client's lungs. The auscultation pattern used for comparison is A. Anterior to posterior. B. Lateral to posterior. C. Side to side. D. Top to bottom. And the correct answer is C. Side to side. The intensity, pitch, duration and quality of breath sounds are compared side to side auscultation of lungs filled. While measuring central venous pressure, the 0 point of manometer is adjusted to A. Anterior axillary line. B. Mid axillary line. C. Posterior axillary line. D. Shoulder level. And the correct answer is B. Mid axillary line. 0 level of manometer is adjusted to mid axillary line at level of patient's right atrium. Concentration of oxygen percentage in expired air is A. 78%, B. 13 to 16%, C. 4 to 5%, D. 1%. And the correct answer is B. 13 to 16%. Recording of electric activity of skeletal muscle is known as A. Electromyography. B. Electroencephalography. C. Electrocardiography. D. Electroconvulsive therapy. And the correct answer is A. Electromyography. Electroencephalography is recording of electrical activity of brain. Electrocardiography is recording of electrical activity of heart. Electroconvulsive therapy is treatment modality used in severely depressed client. The solution used to disinfect the linen of HIV positive patient is A. Dettol. B. Lysol. C. Savlon. D. Sodium hypochlorite. And the correct answer is D. Sodium hypochlorite. Sensitivity and reaction is tested by administering the drugs A. Intradermally. B. Intramuscularly. C. Intravenously. D. Subcutaneously. And the correct answer is A. Intradermally. Sensitivity and reaction is tested by administering of drugs intradermally. Goniometer is used to assess A. Auditory power. B. Muscle strength. C. Range of motion of joints. D. Visual acuity. And the correct answer is C. Range of motion of joints. A goniometer is an instrument that measures the available range of motion at the joints. The most common presentation in portal hypertension is A. Hysterexis. B. Hematemesis. C. Elevated blood pressure. D. Confusion. And the correct answer is B. Hematemesis. The portal hypertension is an increased in blood pressure within portal venous system. Veins coming from stomach, intestine, spleen and pancreas merge into the portal veins which then travel through the liver. Hematemesis, hemorrhage or melena are Common presentation in portal hypertension. While giving NG tube feeding, which of the nursing action prevents complications? A. Advance tube 2 cm. B. Flush with 20 ml of air. C. Provide high Fowler's position. D. Plug the air vent during feeding. And the correct answer is C. Provide high Fowler position. High Fowler position helps easy administration and also to prevent regurgitation. The size of intravenous cannula is used for neonate is A. 18 gauge, B. 20 gauge, C. 22 gauge, D. 24 gauge. And the correct answer is D. 24 gauge. 37 degree is equal to A. 98 degree Fahrenheit, B. 98.6 degree Fahrenheit, C. 99.6 degree Fahrenheit, D. 99.8 degree Fahrenheit. And the correct answer is B. 98.6 degree Fahrenheit.